felt like an animal. I was handcuffed and having a lot of pain in my tummy, and I asked the officer if she could loosen my handcuffs, and she argued she couldn't do it.
In 2023, Laura was in hospital in the late stages of pregnancy. She had suspected preeclampsia, a condition which can be life-threatening. A prisoner serving time at HMP Bronzefield, she was restrained in handcuffs and in labour. We've changed her name, and her words are spoken by an actor.
Many times I asked them to remove the chains. I couldn't have privacy with the doctor. I couldn't use the toilet properly, and sometimes I couldn't even walk properly. I couldn't sleep. It was hurting me. Every time I asked them or questioned them about the handcuffs, they told me that they had to use them. It was the rules.
Laura was in jail for drugs and deemed a low-risk prisoner. And we've discovered multiple cases like hers where women are restrained during or after labour, something which is only supposed to be allowed in extreme circumstances.
I felt humiliated. The last thing a woman would think about is escape when she's in such a vulnerable situation.
But as this programme has revealed, Laura is not the only woman prisoner at HMP Bronzefield who was restrained during labour. And it's something that's highlighted a much wider problem.
The fact that the prison service, frankly, get it wrong so frequently is an issue that we should all be concerned about.
Adrian Usher is the Prisons Ombudsman. It's his job to investigate complaints and deaths in jails. He was shocked at what Channel 4 News has exposed.
I cannot imagine the circumstances in which, during labour, restraint is appropriate. We investigated a case relatively recently where inappropriate restraints were applied after childbirth. There's no way for a child to be brought into the world.
It's not just pregnant women the Ombudsman is concerned about. He says his own investigations suggest thousands of prisoners are being wrongfully restrained every year during medical procedures. He's regularly reporting on elderly, infirm and immobile prisoners being chained in hospital, in clear breach of prison policy.
We have seen inappropriate restraint in really extraordinary circumstances. We investigated a case last year in which, while a prisoner was having his leg amputated, he was restrained to a prison officer. Now, again, I can't see how that could possibly have been appropriate. And even for the prison officer must have been a horrendous experience. And I know that the cause in that case was a kind of slavish following of bureaucracy. They hadn't removed the restraints because the form allowing them to remove the restraints hadn't arrived at the prison.
A man who's having his leg amputated?
Yes. And in another case, the prison officer was reluctant to remove the restraints from a prisoner without getting the appropriate authority and documentation from the prison. And this despite the fact that at the hospital, medical staff had pronounced the prisoner dead.
We've been given details of one investigation by the Ombudsman into the case of a prisoner who'd been transferred to hospital to die. Barely able to move, he was handcuffed to the bed anyway. The cuffs gave him agonising sores, and in the end he was in so much pain, he begged to be allowed to go back to prison, where at least he could die without being restrained.
I feel it is often the case that the process is flawed, that the staff on the ground at the hospital who can see what's happening and are listening to the patient very often do not have the authority to be able to make a humane decision, even in extremis.
You don't need rules and guidance to show humanity or to give people dignity in death.
I think the quality of leadership training within the prison service and the training, initial training of staff is suboptimal. You can't make blanket assessments about restraint. You need to take into consideration all of the factors, the prisoner's healthcare, the prisoner's age, his likelihood of escape, his likelihood of harm to others, and then make a professional judgment on an individual basis. And I'm afraid just too frequently the prison service isn't doing that.
The Ombudsman acknowledges there are some very challenging prisoners in the system, but he says he's made 235 recommendations to the prison service about the use of restraints in the deaths he's investigated over the past 5 years, and he says things are not changing quickly enough. Now there's new pressure coming from the highest level. Following our reports on restraints being used on pregnant women, the Justice Committee has written to the Prisons Minister to demand action. In his reply, the Minister Lord Timpson acknowledged he too was deeply concerned to hear of these allegations at HMP Bronzefield. He's asked the Prison Service to conduct a deep dive review into the use of restraints there and in other women's jails. Although he said there was nothing to suggest this was happening in the wider women's estate, he admitted data on this was not something we routinely collect.
I don't want this to happen to other women. I was already paying for what I did. The baby didn't have anything to do with this. I think it was very cruel.
In a statement, a spokesperson for HMP Bronzefield, run by the private company Sodexo, told us,
"We completely understand the level of concern and are conducting a thorough investigation. These historical claims are subject to ongoing legal proceedings, which means that we're unable to provide any specific comment on individual cases. We take the safety and well-being of the women in our care and of the general public very seriously and have robust assurance systems in place to ensure that current practice is fully within appropriate guidelines."
The Ministry of Justice told us,
"Our policy is absolutely clear. Pregnant women should not be restrained for hospital appointments unless risk assessments have deemed it essential to do so. We undertook a short period of intensive review regarding cuffing arrangements, particularly in relation to prisoners with end-of-life and palliative care needs. The findings were discussed with the Prisons Ombudsman and will be incorporated into future policy amendments."
it's been almost 30 years since the Prison Service was ordered to end shackling pregnant prisoners in hospital, except in extreme circumstances. The review into why it's still happening and just how often is due to report next month. Well, we're now joined from Westminster by the Labour MP Andy Slaughter, who's chair of the Justice Committee. Andy Slaughter, I want to start, if I can, with pregnant prisoners. The Ministry of Justice told us our policy is clear on pregnant women, but it's either not clear enough or it's being ignored. Are you worried that this practice might be systemic?
We're very worried about this, and we investigated this, or we've asked the government to investigate it, as a consequence of the Channel 4 reports earlier in the year. Our concerns are exactly as you say. How widespread will this be? Because it's absolutely clear that this is contrary to policy, has been for years, if not decades. So if it is happening in the instances that you've given today and in previous reports, then how widespread is it? And that's what we're trying to get to.
Exactly. So this deep dive review that the Prisons Minister, Lord Timpson, has triggered, what do you need that review to do?
Well, I have to say that there wasn't a quick response and a sympathetic response from Lord Timpson, and he's clearly addressing the matter personally, and he has ordered this review. We did, however, notwithstanding that, go back to him again just a couple of weeks ago and say what we're really interested is to know that this is not happening anywhere in any prisons, any women's prisons, irrespective of who runs them, whether they're public or whether they're private. And we want to know not the individual details, but we want to know this isn't happening at all. There's no doubt about that it shouldn't be happening at all. And we want something that is thorough and systemic in that way.
I mean, you saw in the piece there that the wider issue of the use of restraints inappropriately is a real concern of the Prisons Ombudsman. I mean, do you share that concern?
Yeah, well, there are several ways this can be investigated. Clearly, that the individuals who feel that they've been mistreated can take their own legal advice and action. I'm glad that the Prison Ombudsman is looking at this, and he again has powers to order either compensation or indeed to recommend policy changes. But what we're concerned with, as a committee that's looking at overall policy and practice within the prison service, is to make sure that this is not happening anywhere. And to take your point about analogous situations, other people, other than pregnant women, who may be subject to some indignity or mistreatment, who are elderly, who are infirm in that way, who present no risk of escape or violence or other reasons why it might be appropriate to keep people restrained. That's what we want to know the answer to.
And just very briefly, I mean, there may be people who would argue that, you know, these prisoners have done something wrong. You know, prison officers have to assess the risk. Being restrained in hospital is just one of the punishments that comes with going to prison.
I hope not many people would say that. People are punished by being sent to prison. If they are for reasons of giving birth or reasons of ill health or even reasons of suffering from a terminal illness and going to hospital to die, then they need to be treated sympathetically. I don't think anyone would have any problem with that. Nobody denies that this is something that shouldn't be happening, and therefore we have to make sure it isn't happening anywhere on the prison estate.
Andy Slaughter, thanks very much for talking to us this evening.